Broadcasting from the Paddock Mall Studios, this is WOCA, Ocala, Gainesville, The Villages, 1370 AM, 96.3 FM, The Source.
If you have back pain, I want you to pay attention. I just knew that the best intro would just be to just to say it that way.
Exactly.
Usually I have this flowery intro. All I have to do is say, if you have back pain, just listen up. Because if you do, it's no laughing matter, and you want to hear something that's going to give you some relief. Dr. Bradford T. Butler is on the phone. He's an award-winning doctor of chiropractic. He's one of the pioneers of the patient-centric office movement. He's a New York Times best-selling author. The book that he's on the phone to talk to us about today is called The Blueprint for Back Pain Relief, the Essential Guide to Non-Surgical Solutions. Dr. Butler, it's an honor to have you on our show. Good morning.
Good morning, and thank you for having me.
Yeah, you're welcome. Where are you right now, first of all? Where are you calling from?
In the frigid northern New Jersey suburb of Bergen County.
Where does your son live, Rob?
Clifton.
Are you
Sure.
near Clifton? Yeah.
Yeah, I have an office in Wayne, which is 2 towns away.
Do you have snow?
We got flurries last week, and we're expecting a nice shot tomorrow, I believe. It's great to be up here, by the way.
Yeah, I love that area too. So tell me about back pain. I introduced you in the most simple way possible. I just said the 2 words that are going to catch everybody's attention who is right now dealing with back pain. Just by saying it, people want to know, what can I do? And everybody's got their own answer. So what is yours?
Well, there's no one answer, and that's the whole thing.
Okay.
The back is a very complicated structure. It's not a simple thing, as many of us have been led to believe. If you ask anybody, they'll just point to their back and say, I have back pain, as if that's the cause. But the spine itself is made up of multiple different parts, and each one of them could cause pain. So unless you know what your pain is coming from, you don't know how to actually effectively treat it. And typically, masking the symptoms is not the angle you want to play. And the reason is your body's trying to tell you that there's a problem that needs to be addressed. So if you have a cavity, I use this as an example all the time. If you have a cavity, you need to have the cavity fixed, right?
Right, sure.
So you think I was crazy if I told you to load up on Tylenol so you didn't feel the cavity anymore, exactly. And that's your solution.
Exactly. And you kind of anticipated my question, I guess, because I was going to ask, what should we not do? And you just answered it. We should not be, taking the Tylenol, the aspirin, the ibuprofen all day long, right?
Yeah, I mean, that's correct. I mean, sometimes you can, of course, self-medicate. That's why we have over-the-counter medications for short-term relief. And if you look on them, a lot of the warning labels tell you do not use this for long periods of time. And there's a couple of reasons. Number one, there's side effects. And I like to call them effects, not side effects, because it's not really a side effect if you take it and it happens to you, right?
That's true. Yeah.
It's actually an effect. The other thing is long-term masking of symptoms leads to further damage. And that's kind of the angle of the book that I wrote, was to let people know, number one, there's a better way. Number two, we've kind of reversed the process because of the profitability of the pharmaceutical companies, right? The drug makers make so much money, they advertise so much,
absolutely,
that the average American either looks on a billboard or watches a commercial or opens their newspaper, and it says, if it hurts, take this. And we kind of get brainwashed.
Right. Oh, my gosh, you're singing our song. So how do we know that it's not a muscle, or it's not a nerve, or it's not an organ going bad? How do we know what's causing the back pain?
So I'm going to address this from a slightly different angle than the question, which is how do we know when to get it looked at, right? So I think that's almost the more important question. I think if somebody has short-term stiffness or achiness after they've done something they don't normally do, like, I know in Florida you guys get to play golf all the time, but up in the north we actually have to take a break. And usually
you come to
April,
Florida. My cousins come to Florida.
I have to get a house down there. But in April you have all the weekend warriors going out swinging a golf club for the first time in 6 months. And yeah, that's going to cause pain. So if you're just looking for temporary relief, sure, you can do that. But if it's something more chronic, something that has a tendency to repeat itself, that doesn't go away for a long period of time, but becomes more repetitive in nature, that's when you want to start asking the question, hey, Maybe there's something else going on here. Now, to discover what it is that's causing your pain, that's when you want to get professional help to find out what is it. Is it a muscle? Is it a ligament? Is it a joint? Is it a nerve? Could it be a disc? There's lots of different causes, and that's why the back is such a complicated thing.
Are computers and electronic devices attribute to back problems?
Yeah, I mean, don't most of us think about the guy who's lifting something really heavy, or the lady who's lifting something heavy, is she injured or he injured himself? We think you have to do something physically to cause damage, but a lot of times it's a lack of physical activity that causes the back problem. And we're seeing clinically, we're seeing the same problems in young teenagers. I've been doing this for 20 years. That 20 years ago I wouldn't see until somebody was in their late 20s or early 30s.
Wow.
And the reason for that is because kids, I don't know about you guys, but I'm approaching the half-century mark, and when I was a kid growing up, you just didn't have a ton of homework. You didn't play sports year-round, so you were outside being active all the time. And these kids they're on laptops, they're on iPhones, they're on Xbox, they're sitting all day in school. So there's so little activity that the spine adapts to that negative kind of lack of influence, and it gets unhealthy.
Oh my gosh! So what you're saying is, if we move around a little bit more, we'll be able to prevent back pain, right?
Without question. In my experience, most back pain comes from actually a lack of mobility, not too much mobility.
So that would be a part of, I don't know if prescription is the right word, but that would be part of your ideas on what you could do to reverse it, right?
Yeah, so if you think about it, none of us are ever going to get away from these computers these days, or driving, or things of that nature. So one of the best ways to prevent back pain is actually to have some sort of a regular regimen of mobility, some sort of activity. And for people that actually have back pain, that currently have back pain, they actually still need the same thing. They have to start moving more to help the back pain go away.
Some people like to self-diagnose. They love to go on the internet and put in their symptoms and find something. Do you discourage that?
The research that I've read on that is that it can be negative, because you can overestimate the problem, you can underestimate the problem. It's hard to get away from it, though, right? Because it's tempting. It's right there. It's, we all have a computer or a phone now that we can look anything up. And so I had somebody recently walked up to me and said, "I have a stomach ulcer." And I said, "How do you know?" And they said, "Because I have a stomach ache, and it's in the morning. It's the same time every morning." And they were basically diagnosing themselves with a stomach ulcer when it had nothing to do with the stomach ulcer. So we do have to be careful to self-diagnosing, because we don't have the expertise, do we?
No, not at all.
No. So how does the book help us? Does it guide us as to how to take care of the back pain ourselves, or does it direct us to a specific type of doctor, like a chiropractor, like yourself?
There's lots of different types of professions that can help us, but I wrote the book from an angle that I want people that are listening to your program right now to say, we've got this whole thing backwards. We usually wait and we wait and we wait. And like you were saying earlier, Larry, we self-medicate, which causes more time. We don't know that we're degenerating more because we can't feel it. And then the first thing that we do is we usually see the doctor that does the most invasive thing first, right? So we'll go to an orthopedist.
Yeah, right.
We'll go to our primary doctor. They'll give us an injection, a pain management doctor, when in reality, what we should do is the more conservative things first. So there are tons of different doctors, chiropractors, physical therapists, acupuncturists, that can all help us in getting better without drugs and surgery.
I learned a new phrase from you, patient-centric and doctor-centric. What is the difference?
I'll tell you, it's one of my favorite things to talk about. Growing up, we've all had to go to doctors, right? And today our customers, our consumers, we call them patients, but they're really customers, aren't they? They're looking for great doctors, right? But they're also looking for a great experience. They don't want to sit in a waiting room for 45 minutes before they go into a treatment room where they sit for another half an hour, and that 1 hour appointment turns into 2 hours or 2.5 hours. So the patient-centric office, like the offices that we've created, we angle everything from the patient's perspective first. So we have no waiting policies in every one of our offices. We never overschedule, unlike, it probably sounds like, splitting the atom to you guys, but you don't have to overschedule. Yeah. And in most of the research, and I actually include the research in my book, a lot of doctors are trained to overschedule, and it's just the opposite of what people want.
Yeah. Absolutely. Yeah.
From waiting to convenience to same-day guarantee, that's what patients really want these days, to get the best care as conveniently as possible.
Dr. Butler, thank you for being on the air with us. I have a copy of Blueprint for Back Pain Relief. If you would like the copy that was sent to me, call me. I'll pick one call at random and give it to that person. The rest of us have to go buy it. I found it on Amazon. Do you have a website you would prefer we go to?
No, go right through Amazon. It's the easiest. Everybody knows it.
Okay, excellent. Dr. Bradford Butler, have a great Thanksgiving, and thank you for your knowledge.
You too, and thank you so much for the time.
We'll be right back.
Tis the season to be merry at the